Yeah, and we'll talk about that. Yeah, let me see if George is.
George, I gave you permission. George Pipkin, I gave you permission.
Oh, you did?
Yeah, just press record.
Okay, I requested it. Dr. Joseph, behind you, I see a bulletin board with some notes on it. Is there any patient information anywhere hanging there?
Okay, I'm recording. I got it.
Okay,
Okay.
great.
Nope. Okay. Cannot be moved. Okay, no, that's fine. I just, mostly for HIPAA and privacy, I just want to make sure that if somebody zoomed in, there wasn't any patient information. Actually, no. You can't even see it now.
Yeah, that's perfect. Now it's perfect. Yeah, you can see.
Old phone, so you can't really see it. How's that?
I think that looks good, and you got your.
That looks really good. That looks really good.
That looks perfect.
And you got your Miami Cancer Institute logo there. Perfect.
Great.
Patsy will be on top of us if we don't do it. She would be very upset.
Like, Patsy told me to bring lipstick. I was like, okay.
Oh my.
No, you look great. All right, let's get started. I'm going to go ahead and put myself on mute. George, you're recording?
Yes, ma'am.
All right,
And
so
John,
once again, you'll edit everything together. So if you want to restart what you're saying, Doctor, please go ahead. But let's start with. I really like to know what was the first thing that came to your mind when you heard and read about Mr. Bozeman's death from colon cancer at the age of 43. What was the first thoughts that you had regarding this case?
So that's a great question. So as a GI, a gastroenterologist, oncologist at the Miami Cancer Institute, I treat colorectal cancer. And a lot of my patients are under the age of 50 at time of diagnosis. So with the passing of this Hollywood star of Chadwick Boseman, it really left me with looking at him as a role model for our youth of today, a role model to bring awareness to colorectal cancer. So it is a tragic of what happened, but if I'm looking in the positive light of this tragedy, it made me be more aware of how we can bring forward awareness to our society, awareness to our population to be screened earlier and to catch this disease in its early curable stages.
And there has been, and we've written about recent studies regarding the rates of colorectal cancer increasing among adults under 50 and decreasing in adults over 50, probably because of the push to get older than 50 screened. So can you address that? And do you see this trend, higher rates in younger and lower rates in older? And maybe what's the reason you think for that, if you can?
So classically, all our screening has been geared towards a population age of over 50 years. So in that general population, in the above 50 to about 74 years old, that incidence of colorectal cancer has been decreasing. And that is predominantly because of increasing in screening, which are colonoscopies. The incidence in the age group less than 50 has been increasing. It has increased, I would say, about 13%. So in general, the American Cancer Society in the year 2020 has averaged new diagnosis in the US of colorectal cancer to be about 150,000. Out of 150,000 new diagnoses of colorectal cancer, 10% are diagnosed before the age of 50. So that's about 1 in 10 of an incidence that patients less than the age of 50 are diagnosed with colorectal cancer.
And that percentage has, I think I read over the last decade, they've studied, they went back and that percentage has been steadily increasing among those under 50, correct?
Correct.
Yeah. And I know they say it's a bit of a mystery why that is. And I know screenings is the one key factor. The obesity epidemic certainly contributes, unhealthy lifestyles. But once again, going back to Mr. Bozeman's case here, a very physically fit, played superhero, is there a genetic factor involved? So let's talk to the possible risks for younger adults, if you can. Please.
No problem. So I believe you touched on it a little bit. So it can be divided in genetic and non-genetic predisposing risk factors. So the non-genetics would be the obesity, smoking, the diet. So a lot of processed red meats, for example. Smoking also plays a huge risk factor in developing colorectal cancer. if we look at the non-genetic, so the genetic components of increased risk of colorectal cancer, I think the biggest thing to look at is we do have genetic predisposing conditions. The biggest ones are called Lynch syndrome. The other one is called familial sorry, you can edit that one, but
Go ahead with the two
it is-
syndromes again, yeah.
it's called FAP, so familial adenomatous polyposis. If we look at the incidence of this in a younger age group, the biggest telltale sign is speaking to your family, talking to your family, getting that history. If, for example, in the case of Chadwick Boseman, he was diagnosed in 2016 around the age of 39. So what would I tell his family members in the future? Because at the age of diagnosis of 39, you would be screened 10 years earlier. So you would be starting to screen at age 29. For example, if your parent was diagnosed with a colon cancer at the age of 49, then 10 years earlier, you would be screened at age 39. So it's always 10 years earlier than at the age of diagnosis of your first degree relative. So that is a screening criteria. Then we can do more genetic testing to see if you have an inherited gene or a DNA repair mismatch gene protein that would predispose you in having Lynch syndrome, for example.
That's a great information. I didn't realize that. Is that regarding immediate relatives, siblings or parents, or?
So first degree relatives, correct.
Do you want to restate the two syndrome? You mentioned the two syndrome. I know they're hard to pronounce. I don't know how we want to say this for the.
So Lynch syndrome is one of them. The other one is familial adenomatous polyposis.
Okay. Excellent. So we've talked about the lifestyle and the genetic factors, particularly knowing your family history, which I know we stress a lot on a lot of issues, a lot of top health topics, heart disease and cancer. But we're in the middle of a pandemic, and a lot, as we all know, and a lot of folks may have put off screenings and regular checkups even, and those at risk, younger folks or over 50, may have put off colonoscopies or even the screenings for low risk, the screenings at home through I forget the name, but what is the takeaway here, the message to those folks who may have put off, getting screened in the last several months, especially in light of Mr. Boseman's death?
So COVID-19 is a worldwide pandemic in which the healthcare field has grown and has adapted in providing safer screening processes. So in patients coming in, having a mask, washing their hands, social distancing, that's their part. Our part as healthcare workers, we clean machines, we schedule patients with longer time gaps in between. We developed more safety precautions. In times of delaying screening, a lot of the times that adversely affects patient care. So for example, if at the time of a diagnosis with a colonoscopy, we found a precancerous polyp and that was removed, patients do well, they go ahead and have another screening colonoscopy in 5 to 10 years. If, for example, with the pandemic, that is delayed by a couple months to a year, and at the time that precancerous polyp now becomes cancerous, and that delay was due to a delay in screening because of the pandemic, it puts that patient at higher risk of developing a cancer, higher risk of having decreased survival. So in the grand scheme of things, the healthcare field has become cognizant of COVID-19, and we are encouraging patients to still come, call their family care provider. They can call Miami Cancer Institute providers if they have any questions about signs, symptoms, screening guidelines. We'll be more than happy to provide them with information and the appropriate contact information as well.
Great. And I know this applies to obviously adults, especially 50 and older, who are at average risk or at low risk. Anything about guidelines for the guidelines that have changed a bit over the years, the last couple of years, the general guidelines for screening? You said 10 years before, if you have a family member, 10 years before that family member was diagnosed. But for everyone else, it's still, I believe it was moved down or sooner, right, from 50 to 45 for some folks. Can you clarify that?
So that is correct. Because of the disparity between African American populations to the general populations and the increasing incidence of colorectal cancer, a lot of our consensus and guidelines has moved down screening colonoscopies to start at age 45.
And any final takeaway or message in light of Mr. Bozeman's shocking death over the last few days? Any last takeaway from that you want to tell folks?
So colorectal cancer is a cancer that is preventable, and a lot of the times in the African American population, that incidence has been increasing. So what are the things that we can do to bring awareness and to help that population so we can actually catch the cancer early and prevent it from being diagnosed at a later stage? And that goes hand in hand with access to healthcare. In addition to that, it's a lack of awareness. So I think as a society, if we can promote screening colonoscopies at age 40, if we can promote access to healthcare, in addition to that, one thing that I would like to mention is just signs and symptoms that a lot of the times we go day to day and we don't know what to do. What are these signs of? So colorectal cancer, these are the signs to look out for. If you are diagnosed with a new iron deficiency anemia that we don't have an explanation for, if you have any change in your bowel movements, for example, change in texture, change in shape, if you have any blood in your stools, these are the times where you can speak to your primary care physician, or you can call one of the Miami Cancer Institute providers to get more information on the next steps of what to do.
And in many cases, there are no symptoms, right? Early on, especially, correct? I mean, or very
correct. Yeah. Therefore, that's when screening comes into play. So without any symptoms, we do encourage the general populations to start screening at age 40. In the African American populations, age 45. Or if you have a first-degree relative, 10 years earlier than their age of diagnosis.
Great information, Doctor, and well said. And Georgie, do you have anything else you want to ask, or George?
The only thing I was going to add maybe to that ending is for folks to just not be afraid. Because we're in this pandemic, people may be afraid to go get their screenings. So maybe just a one line about urging people to continue with their health care and taking care of themselves and not to delay any kind of care. Because of the pandemic, the hospitals are clean, getting your screening, everything is ready, safe, and available. And if you're doing more damage by delaying your care. So if you want to just, because of the COVID landscape, I think, especially for the news folks, I think it's helpful to convey that message just one more time about not delaying your care, to go ahead and get those screenings and make sure to take care of yourself early.
Okay. So in light of COVID-19 and cancer in general, not only do we have preventative measures for colorectal, but we also have screening for breast cancers, for cervical cancer. And in the light of COVID-19, we urge you not to have fear to get these screenings, but to visit one of your primary care physicians or Miami Cancer Institute in order to get these screenings done. We are available, and we have adhered to a lot of cleaning, should I say that, cleaning policies?
You want to restate?
Georgie?
I lost you.
Can you guys hear me?
Yeah, your internet cut out a second.
I think you're back. But...
Oh, I was going to ask, do you want me to say, have, strict cleaning policies at the hospital?
No.
Where they do their screening?
No, I think what you said was enough. Perfect.
Yeah, and I think you addressed that earlier.
That's fine? Okay.
Yeah, perfect.
Great, yeah. And George, you're good?
Have her repeat the end again, because I think her internet cut off.
Which part?
Just the last part, just because of COVID-19, don't be afraid to come to the hospital.
Okay.
Oh, you want me to repeat that? Okay. In light of COVID-19, we urge the general population to adhere to our screening policies. Not only is colorectal cancer preventative, but breast cancer is, in addition, cervical cancer as well. So do not fear to come to the hospital. Hospitals are practicing social distancing. We wear appropriate masks and cleaning policies as well.
Perfect. Thank you, Dr. Lorenzo.
Perfect.
Yeah, we'll be.
We appreciate your time. I'm sure
you.
Patsy will be in touch. We'll get these things